Welcome to the Vet Dental Show. I'm Brett Beckman. I'm a board certified veterinary dentist, and we come to you every week on Wednesday to provide the veterinarian and the technician team some actionable things that you can use in your practice. And this episode is going to be a recorded episode that we've done in the past, not a podcast that we've recorded or not the Vet Dental Show, but actually some other information for you that we know you're going to enjoy. So sit back, enjoy, and we'll see you at the end of the podcast.
Kitty cats that are fractious, those are challenging cases, and absolutely, gabapentin has been used as a behavioral modification drug, and absolutely recommended for these cats. And sometimes we can wrap them in a towel enough to get them pre-medded. Sometimes we do have to mask those patients down in order to get them under anesthesia, because we're just not able to place a catheter or give propofol IV. So we don't use a tank at all. We just use the towel, wrap them in a towel so they're secure, so that they can't hurt us. And we just place a mask and mask them down with isoflurane. So those cases can be challenging, but that is, we try and be, again, as fear-free as possible. And we do have a set of, wildlife gloves that we can kind of wrangle these patients, but we find that covering them in a towel, wrapping them, it really calms them down. We use Feel Away and put that on anything that's going to be in contact with that cat, whether it be in the cage. The towel that we're going to wrap them in is got that Feel Away on it to try and help calm them down. But certainly gabapentin is a useful drug in that case. Trazodone is another medication that's used for our canine patients that tend to be difficult to handle. And so that's certainly another medication that won't interfere with the protocols that we're using, and we can still handle these patients safely and get them under anesthesia. Were there be any instance in your high-risk patients to not use hydromorphone midazolam? Our high-risk patients primarily are liver patients, kidney patients, and cardiac patients. And our cardiac patients, the cardiologists typically recommend a narcotic, a benzodiazepine, and then inducing with propofol and alfaxalin. So I haven't really run into a point where we've had to change this protocol. We do find that hydromorphone, however, in cats can sometimes cause hypothermia. And we have done CRIs with hydromorphone and have found that some cats on that CRI can get hypothermic. So we don't use that in cats. That's why we use the buprenorphine. But for our high-risk patients, that's as pretty much as benign a protocol as you can do. And so we really haven't had any issues with needing to change that. Good question. Is there ever a situation from Sarah, ever a situation where the hydro and the midazolam aren't enough? And do we give additional meds? Good question. We don't use the dexamethasone, although it's very, very nice in those fractious patients. It's just too much sedation. We will use hydromorphone in conjunction with butorphanol. Butorphanol, or torbugesic, is one of those medications that's used as a pre-med routinely with acepromazine. And I don't like that combination. Acepromazine, again, is way too much sedation. And it also lowers body temperature and lowers blood pressure, which is something that we just really don't want with our dental patients. It's already putting us behind the 8 ball. So we don't use acepromazine. It's just too much sedation, and then it tends to linger. I get a lot of phone calls from folks that say, I had my dog's teeth cleaned about a year ago. but I think they used too much anesthesia because it just took him forever to wake up. And I know that most likely they used acepromazine, and that dog was sedated for 2 or 3 days. Again, very, very highly unlikely that we're going to get compliance in having that patient come back in 4 or 6 or 8 months, especially those periodontal patients. And so those patients tend to suffer in silence because the owner is too nervous to move ahead with anesthesia. Again, now she has a false sense of security because everything was treated, and 4 months is just too close. And if the anesthesia doesn't go well, highly unlikely they'll come back. So we will use hydromorphone with torbugesic. Butorphanol has much more sedative properties, and so that tends to slow these patients down enough where we can either do a butterfly catheter and get propofol into them, or we can at least get or get an IV catheter into them and propofol them that way. So the hydromorphone and butorphanol at the normal dose given instead of the midazolam. All right, question from Ashley regarding antibiotics. And a lot of questions with regards to antibiotics. And antibiotics are one of those drugs that are overused in dentistry, not only veterinary dentistry, but was in human dentistry, and they're curtailing that significantly in human dentistry. And so we're following that same pattern just because we've had instances of resistant strains. And so we want to make sure that we're using antibiotics appropriately and when needed. So we will typically, for those really advanced periodontal cases where we've got, discharge from infection, we will give IV antibiotics, ampicillin IV typically. But once those patients are treated, and if the extractions are done appropriately, all of that infected tissue and bone is debrided and flushed out during the extraction, and then everything is closed. And so if there is any lingering infection, the immune system should take care of it. The oral cavity is extremely vascular, and so the good news is there's a lot of exchange going on, but it is very bloody. That's just the nature of dentistry because that oral cavity is so vascular. But because there's so much exchange going on that infection is cleared once these patients are treated. We will use post-op antibiotics in those patients that are immune compromised, patients that have undergone chemotherapy, FIV positive cats, those types of immune compromised patients. But in most cases, we are not doing antibiotics unless we're seeing active infection, and then post-op antibiotics for particular patients that require that. If we have a patient with a suborbital abscess where that wound opens below the eye, then yeah, we're definitely going to want to do post-op antibiotics in that case as well. So we want to make sure that we're doing antibiotics appropriately, but not overusing those. And prophylactic antibiotics 2 or 3 days ahead of time, certainly just to knock some of that odor down, but in most cases we don't. So it is a case-by-case basis, and we're using antibiotics very, very rarely. Best materials to use to tie the ET tubes in place, we use we recycle IV lines and cut those to different lengths based on patient size. That gives us some flexibility in tying that behind the ears and getting all of that that tube where we can move it side to side appropriately. Fractious cats and aggressive dogs. Do you recommend blood work the same day or days before the procedure? I'm glad you asked this question. This is something that a lot of folks don't think about. But in our practice, we're a referral-only practice. And so all of the preoperative workup is done well in advance of their appointment. All of our patients are cleared at least 2 weeks prior to them coming in. That way, we know that our schedule is set, and if we do blood work that same day on one of those patients and it comes back abnormal, and we've got to postpone that, now we've got a spot that could have been used by someone that I can't fill that spot. And so I would recommend that same type of protocol for a general practice. I would clear your patients well in advance of having them come in. For those fractious patients that, blood work is difficult, again, pre-medding with gabapentin or trazodone in order to get that blood work done, because that way your schedule, you're using your time, as with as much advantage as you can, where we're not losing spots by doing preoperative workup that same morning and possibly having patients that aren't candidates for anesthesia and need to be managed until they are. So I would recommend having everybody cleared well in advance of having their dental procedure. What would the expected time frame be for full mouth dental rads? From Nicole. And this is a really good question with regards to timing. And here are the goals. For a small dog and cat, 5 to 10 minutes, typically less than 10 minutes. And with practice, certainly under 5 minutes is not out of the realm of possibility. And you can get there pretty quickly with practice. Large dogs, less than 15 minutes. And so we talked about practicing. And when we talk about practice, that means using a cadaver specimen, not one of your patients. We don't want to have anything under anesthesia. We want to make sure that we're doing this in a low risk, low anxiety environment. So you want to make sure that you're practicing at a time when you're off the clock, or at lunch, or after the practice is closed, or if it's slow and there's no dental procedures going on, where you can just focus on taking x-rays. That will help tremendously in getting your confidence level up and getting your speed up. The other two components are consistency and using templates. Consistency meaning we do it the same way every time. And so whenever I do a case, the steps that I complete that case in pretty much follow the same pattern. And so they become second nature. I don't even have to think about it. I induce my patient. I start taking dental x-ray position and start taking dental x-rays. And I take my dental x-rays in the same order every single time. And my templates are set up in such a way that it captures those x-rays as I'm taking them. And so I don't have to go back to the computer every time and click and pick a tooth and then move on. I can just take x-ray after x-ray after x-ray. And so that significantly increases your speed as well. So all of the softwares have the ability to do templates. And so if you're not sure how to do that, just get with your tech support. They can walk you through it, but I would highly recommend using that. And that's something that will take some practice. There is a learning curve to it, but with good troubleshooting and being able to use templates, you'll be able to get that time down relatively.
I trust you enjoyed that episode. We enjoyed providing it. If you would, do us a big favor and go to our iTunes page, post a rating and review and take a picture of that with your cell phone and then post it on our Facebook page, and we'll send you the Instrument Use Essentials course. If you also look below, there is a link to 2 live trainings that we do. And one is on radiographic interpretation, the other is on killer tips for quicker extractions. If you have not been to those, register for the one that's coming up next, and the link will be in the show notes on the website, the Vet Dental Show, and we'll get you in and get you a 30-minute, 40-minute overview of those topics that are really insightful and all take home. And then we'll also give you an opportunity to get a great deal and some bonuses on those 2 courses that are online courses that span 5 hours and 7 hours. So hopefully you enjoyed this episode. Hopefully you'll help us out with the post on our Facebook group. And then as a little extra bonus for you, you've got that link down there. You can register if you haven't been to either one of those and enjoy all of that content that we're going to give you on those 2 topics. So take care. We'll see you next week.